Hey, good morning, everybody, or good afternoon, depending on what part of the world you're joining from. I know you're usually used to me sort of talking and flapping my gums, but I brought a really smart person along with me today to make me look good and make me sound smart. Nadia, how you doing?
I'm good. Good to be here, Doug.
Well, I appreciate you coming in. And today we want to talk about. I mean, this may seem a little bit off kilter as stories. How does that sort of involve AI? But it's very important, as you and I have discussed, on selling your idea or getting buy-in or really truly understanding who your audience is. You need to understand their story so you can build around that.
Absolutely. I think we are we love stories. We connect with them at a deeper level better than anything else. That's the way, humans communicated in the past, through the ages. So, and it's still relevant even in the digital age.
Well, it is. And Nadia, so tell us your backstory. Okay, I know you've got a story going on.
Absolutely. So I'm Dr. Nadia Boutawi for the audience who don't know us. Um, I'm originally from Algeria, did a PhD in plant genetics in England, then pivoted to human genetics, did research at Harvard Medical School. Then I led a research lab at the University of Pittsburgh for close to 10 years. We resulted over 34 research paper, had multi-million dollar grants that I managed, and then I saw firsthand, even though I was working with in a top class university with world class leaders in research on asthma, two of my kids had asthma, and I saw the lack of drugs to treat the disease. So that was really personal for me. And I wanted to know, why is there great discoveries, but it doesn't translate as fast into medicine that can help the people that need it the most. So I was on a path to translate these discoveries. I did tech innovation and entrepreneurship, and then started Nanonaires, which is a biotech company, to improve the preclinical testing so we have better prediction of which compounds are more likely to work in humans before we get to humans.
Well, that's great because I have asthma as well. Mine's aggravated by allergies more than anything else. But
Mhm.
so what? Let's talk about the patient experience. So I recently was scheduling for a knee replacement surgery.
Yep.
Um, I'm starting that journey towards $6 million or probably $60 million with inflation now, man, type thing. But I filled out. I mean, I had to fill out a form at the hospital where the surgery is being done. I had to fill out forms for the doctor and then all these different things, and a lot of it was the same information. Now I know AI is not. This is a data portability, but that's just part of the patient experience is not good. And
Yeah.
as you mentioned before we came on, that the provider, their experience is degraded as well as the payer, I think you said.
Mhm.
So, what are some ways that we can remove the friction from some of the other patient experience that goes through? We all go through this thing, and seeing the doctor is the best part. It's all the other stuff you have to get to go seeing the doctor that's not so pleasurable.
Yeah, yeah. One example that comes to mind when it comes to improving the patient experience is the Cleveland Clinic. They did an overhaul for their whole system, and it starts from the first touch point where you get in touch with the hospital system, whether it's the booking, whether it's the wait list, whether it's parking. If the main hospital is in a busy area and you have an emergency and you are having a hard time parking, that first touch point is so critical. The other thing is, all of the people that are involved in that healthcare delivery are part of the experience, including the janitors, including the supply chain people, the lab people, the doctors, the nurses, the PAs, the physician assistants. So it's the whole staff and facilities that will streamline that experience. Another side is the things that could be automated,
Hmm.
but it's not. The things that take a lot of time for the physicians, for the healthcare providers, and it's high cost because they are the most expensive part within the healthcare delivery.
Hmm.
Yet it takes time, like the tracking, the recording, pulling information, the fragmentation of information. Maybe if you go to one healthcare system, then for some reason you need to go to a specialist in a different health system. You're
Hmm.
going to have to re enter all of the information, which is painful.
Yeah, to say
and
the
not
least.
efficient. So there is definitely room for improvement, at least in the data entry, in retrieving data, as well as if it's fragmented, to combine so you can have, an overview so different specialists can have access to the same
Mhm.
information without spending too much time to pull it.
Yeah, you mentioned something, and I wrote about this in a white paper like 15 years ago, sort of this patient journey, and it involves
Mhm.
IoT and some different things like that. But you talked about the time-consuming stuff like data entry,
Yeah.
like the doctor having to transcribe the notes and stuff in there. Now, this is an idea for Microsoft, for which they can pay me later, but they've got this AI assistant, Copilot. Now, it would be nice if
Yeah.
that recorded sort of the conversation while you're in with the doctor, and then all the doctor would have to just sort of review it correctness instead of going back and doing the transcription and just going on because it's there listening real time,
Yeah.
right? And you don't, and that would be a great, I think, a great asset. Then put that in your record.
Yeah, and in addition to the transcription and the voice to text or mining the data,
Hmm.
there is huge potential for multimodality for doctors.
Hmm.
So let's say if you are seeing a doctor for 15 or 20 minutes, that's the average visit, having an assistant there that has the vision, that has the voice, that has the transcription
Hmm.
there, because you're busy trying to get the information out, it's
Yeah.
going to free up your time to do more. If you're a doctor, to do more of the high value,
Hmm.
the thinking, the analysis, and so on. And you may miss some stuff, and
Yeah.
having that assistant there giving you that feedback is critical.
Yeah. And if I hear what you're saying is, the front end of that would be, okay, here's all the patient records history and everything else that I've got.
Hmm.
Again, mining all that data that's in the past and having the model trained or whatever to that, whatever that specific physician is looking for. And here's the highlights and the key bits that he
Yeah,
wants to know. So I'm not answering the same question I answered 5 years ago the same way because
yeah.
that's the same
It's
thing,
going to
right?
change. Yeah, yeah.
Yeah.
And the other thing that has a lot of potential is the personalization,
Hmm.
taking into account your ethnic background, your socioeconomic conditions, your comorbidities that can affect your health, and flagging those before you get worse has a
Hmm.
huge potential. An example I can share, and that's from our research, is that we use the nasal samples to predict, to do some whole genome screen called epigenetic methylation screen. And what it does, you can analyze this whole genome data and then predict with 90% accuracy which person, kid, will have asthma in the future. So the potential for that is that you can flag patients for further follow up before they get to the emergency room. And
Hmm.
we know that's one of the most expensive units in the hospital system. So that has huge potential to move from intervention to prevention in medicine.
Well, yeah, and even the emergency room sometimes that's the primary care for some people, and it
Yeah,
it takes time away from those people that really have these urgent things. It's just not a good experience. We've had to bring my youngest daughter in there several times when she was young because she would throw a fever in the middle of the night on the weekend, so the doctor wasn't there, so we
yeah,
sort of had to go. So that's not a
exactly,
great thing. So,
exactly.
what are some other areas that we could sort of use, or you've seen because you've got vision into all this stuff that you've seen people sort of using AI to make progress to improve that patient experience, and like I said, for the other people involved in the experience too.
Yeah, I think the definitely the data mining for the medical records has huge potential, and Epic, which is a leader in the EMRs, the electronic medical record, is
Mhm.
incorporating AI within their system. They already have the presence
Mhm.
and the market share, so it would be easy for them to incorporate that. Similar to Copilot for, if you're thinking
Mhm.
Copilot for Microsoft, because
Right.
everybody has a PC and their software, almost the same in the
Mhm.
healthcare space for Epic.
Mhm.
So that is one. Another one would be for imaging. It has a huge potential to mining images and detecting, for instance, cancers
Mhm.
from radiology or skin images and so on. So imaging, I think it has a very big potential. The one thing I would caution, it's because AI is dependent on what it was trained on, and a lot of those were trained on mainly Caucasian population, white
Mm.
population. And there were studies that showed that algorithms that were developed to detect skin cancer don't work as well in darker skin people,
Hmm.
in
Right.
African American or
Right.
Latinos and so on. So I would take it with a grain of salt. It really depends on what it was trained on. Bias is another thing
Right.
to be concerned about. But those are the main things that I think will have a huge potential. Gamification for patients, especially for kids, when you are explaining, a procedure for a kid, if let's say you can use almost real time data to create something or stories that they can
Hmm.
relate to, create a coloring book that explains the process so it's gamified and it will stick with them.
Yeah.
Another problem would be the addition to the treatment plans and the
Hmm.
medication. So having those tailored to your cultural background will increase adhesion to taking your medication and reduces the complications down the line, especially for older population.
Yeah, I want to go back to the part where you talk about the training and stuff like that because it is very real. I mean, ideally, AI should be a companion. It shouldn't be the final say in doing things, right?
Yes.
It's there. It's best served to digest all this vast amounts of data,
Hmm.
distill it down to where a human can do this in a reasonable amount of time, and then make the educated decision, right?
Exactly.
And then
Exactly.
taking that a step further, you said that the training data again, and not it's not it's usually not, well, it's inadvertent that the population was Caucasian. Well, I mean, was that because mainly it was Caucasians that were able to get in and get X-rays or something, or was that they just simply didn't think about it? The sample that they took just happened to be that.
I think when it comes to having data sets that represent the population
Hmm.
is very critical to bypass that bias.
Hmm.
Another one is having diversity within the teams that are
Yeah.
developing these AI systems
Hmm.
is also important because there's always, anchoring bias that you would develop something that for the group that looks like you,
Hmm.
or and in terms of accessibility to data, especially in healthcare and drug development and so on, a lot of what's on the market now has been developed on white population and it doesn't work as well
Right.
for other groups. So being conscious of that in terms of the data set used for
Hmm.
training is important.
So in this case here, if we're doing the storytelling from one side of it, we need to tell the story to the researchers, the people that are developing this stuff.
Hmm.
Here's how to sort of frame this. Here's why it's important. Here's the things we should include in the story.
Yeah,
Here's the characters of the story, the background, and all these other things. We're
yeah.
setting the framework, so it's more holistic, right? It fits the target that we're trying to do or what we're trying to achieve.
Yeah,
Is that
and
correct?
I think your a lot of tech developers, they think their technology is the hero of the story.
No, it shouldn't
It's
be.
not. It shouldn't. Your
Yeah.
hero of the story is the target audience that you're trying to help.
Mhm.
That you're trying to solve a problem for them,
Mhm.
and ideally, you would want to engage your target audience early
Mhm.
and enough and throughout the cycle of product development so it's relevant to them. Because what was relevant to you a few years or a few months ago would
Mhm.
be different now.
Yeah, when I was at Microsoft in their days of Windows XP and stuff like that, we
Hmm.
were guilty of developing a product we thought was cool and would do that, right? Not necessarily what the consumers wanted. But over time, they learned to listen, and things are much better now. And that's what
Hmm.
you're saying, don't you? Because there's really smart people that have, hey, I've got the perfect solution for this, but you may be
Yeah,
solving the wrong problem.
exactly.
Right.
Actually, in fact, I did a newsletter on that. The companies that use what's called problem first design thinking.
Hmm.
So they spend more time understanding the problem before they design the solution.
Hmm.
They outperform the S&P 500 by 200% over a period of 10 years. So it works.
Yeah.
And to give an example for the audience about the the bias that is within the cultural setting, if you don't take into account who's
Hmm.
developing ChatGPT, everybody is familiar with that.
Hmm.
There was a research paper that showed if you prompt ChatGPT that I will tip you X amount of money, and then you give your prompt, and you do the same without the tip, you get better results with the tip. And for your international audience, ChatGPT was which is an American company, and tipping is very typical in the culture here.
Yeah, that's something I've had to learn when I travel overseas. Is that's not, it's very much here thing. So we've got a few. I know we're running long, audience, and all, but this was such a compelling thing that went on. You have this blueprint.
Yeah, absolutely.
No. You have this blueprint. So talk a little bit about that.
Yes, I love it. Yes. Yes, the other thing that I'm very interested in is how do business leaders leverage innovation to get an edge in business? And nowadays, you can talk innovation without including AI into it. I'm tech innovation and entrepreneurship certified from the School of Business at Pitt. And I've developed something that I wish I had, like, a year ago. So it's called the AI Blueprint for Business Leaders. What it does, it focuses on, as we mentioned, understanding your audience. How do you use AI to understand your target audience, not only what they think, but what they feel and what they're doing now and into the future? So you position yourself as a business leader with your solution that's going to bridge that now with their pain points and their future, and build that bridge through your solution to solve it. Mm-hmm. It's a very deep, high ROI prompt chain. It's not one prompt. You go levels, the psychography, the demography, what they do, what's their pain points, what's the main problem, what's keeping them up at night. Yeah. And that's ideally, as a marketer or a business person, you would want to tap into that deep level problem that's going into their subconscious. And when you are able to articulate your story at that level, you are in a position of one, and you position yourself as the go-to person to solve that problem. There are other examples on how to do market research, how to do positioning, your unique selling proposition, and much more. It's on my LinkedIn featured section. Yep. And you can download it for free.
And we'll put links to it in the comments and stuff, so everybody has that. Yeah. So I mean, it's at the end of the day, you talk about, again, understanding the deep down what the real problem is, and when humans make a decision, logic comes into play, but it's always the emotion that has the override, right? Yep. It's sort of like my wife always has the override, has the veto stamp on some things I may want to buy because it sounds really cool. And it's really, do we really need that? So that's where, again, using AI appropriately, understanding who your audience is first, and then work your way back to where you are. Exactly. And then making it, I would, in all stories, in all journeys like this of transformation, along the way, you'll have to make some altercations to what your original plan was. It's not a linear progression. It's not a straight line.
Absolutely.
So breaking that into chunks, what do we learn? What do we do? Does that change? And then move on. And you probably include that in your blueprint as well.
Exactly. And I also included some prompts for product development. So you can develop what people want. Not what you think they want or need.
Yeah. Yeah, exactly.
And when you do that, it's a game changer. If we kind of look back to the storytelling, the story is not about you.
Exactly.
You can only tell the right story that resonates with the right audience. And not only that, repel the wrong audience.
Yeah.
That's when you focus. And my word for the year is focus. Focus on your target. Focus on the people you want to bring value to. Think about they having a problem and maybe they're not even aware of it. Yeah. And you have a solution that can help them transform into a better place. But if you don't deliver it in the right way, through storytelling, through understanding them, you're missing a great opportunity to help them.
No, I think you're right. And we'll close on that piece of it. Again, if you're the hero of the story, you're telling the wrong story is basically what it always gets down to.
Exactly.
But Nadia, thanks for coming on. Thanks for all the work that you do. I look forward to learning more from you as we go along, because you're a great storyteller. You put AI in a digestible level that anybody can understand it. But more importantly, you're really sort of doing some great stuff for humankind. And I really want to thank you for that.
Thank you for having me, Doug, and thank you for listening, whether live or on the recorded session.
Thanks. Bye.
Bye, everybody.